Hi friends, this is Dr. Karthik. I am an endodontist, master teacher in Neet MDS. Neet MDS is an online platform which gives complete package of all the video lectures, test materials and question bank which follow the recent trend. Right. So this is a proverb which is given by our past president Abdul Kalam. Any business or any industry needs environment for the success. So this is even up for our Neet MDS preparation. So there are two type of students. So one students will just believe only the MCQ books. So other students which shows environment, they just go for other textbook reference, and those students only crack the NEET exam with the top ranks. Right? So coming to the NEET MDS 2021 pattern discussion. So all this are about one-liners or fact-based. So we from Audit MDS divides the NEET 2021 paper into three parts. One is for picture-based question, the other is for fact-based question, the next is for concept-based question. So this is part one of fact-based question, right, or one-liners. Right, coming to the first question. So which is the predominant immunoglobulin in saliva? So this is a just direct pickup, and there are many previous exams they asked this type of question about immunoglobulin, and it is very easy question, right? So predominant immunoglobulin in saliva is IgA, right? So what are the other things which you have to know about immunoglobulin, right? So these are the other things, other important MCQs you may get it for immunoglobulin chapter. Which immunoglobulin involved in acute infection, right? IgM, chronic infection, IgG, anaphylaxis, IgE. The only immunoglobulin which crosses placenta, IgG. The immunoglobulin which crosses placenta is IgG, but the immunoglobulin which present in congenital infection is IgM. Right. Which immunoglobulin present in milk? Both IgG and IgE. Cold immunoglobulin, IgM. Warm immunoglobulin, IgG. Largest immunoglobulin, IgM. Smallest immunoglobulin, IgG. So these are the probable multiple choice questions they may ask you in next few exam. Alright. Second, what is the drug of choice in anemic? Right. So most of the periodontal infection associated with anaerobic organisms. So the drug of choice for anaerobic organism is metronidazole, right? But what are the other drugs you can give it for anemic? Is it necessary to give drugs for anemic or antibiotics for anemic? No, not necessary for all the cases of anemic needs antibiotic. Only if the patient have some systemic infection or lymphadenopathy, then it needs antibiotics. So there are two type of drugs which given in anemic. Number one, antibiotics, right? Number two, analgesics. So those patients who have severe pain, you can give an analgesics like NSAID, especially Brufen will be given. Right. What are the antibiotics given for the anemic? Number one, metronidazole, 500 mg for every 8 hours, mean 3 times per day. Number two, amoxicillin, either 250 mg or 500 mg, 6 hours, every 6 hours, mean it is given 4 times per day. So 2 antibiotics and 1 analgesics. With that, we also give mouthwash for the patient. There are two type of mouthwash given for the anemic patient. Number one, hydrogen peroxide, and number two, chlorhexidine, 0.12% of chlorhexidine. So these are the two mouthwash given for the anemic patient. So if we just see the reference which is taken from the Kalanza, what they say is about necrotizing ulcerative gingivitis. Antibiotics are not recommended unless it is accompanied by the systemic complications like fever and swollen lymph nodes. So keep this in mind. All the cases of ANAC does not need antibiotics. And in case of aggressive periodontitis, antibiotics use is recommended. Otherwise, most of periodontal disease does not need antibiotics unless otherwise it is accompanied by systemic complication. So even necrotizing ulcerative periodontitis, so antibiotic uses depends upon the systemic condition of the patient. Right. Periodontal abscess, antibiotic use is not recommended. Gingival disease, not recommended. And chronic periodontitis, not recommended. So keep this in mind. So probably you have to know the associated points with the question what you are reading hereafter. So only you can able to answer any type of question which asked in your NEET exam or INA-CET exam. Right. So what are the treatment which is given for the ANAC patient in the first, second and third visit? So first visit, so you have to remove the pseudomembrane. So, but you should not remove the pseudomembrane as such because the patient has severe pain. So you have to apply the topical anesthetics over the gingiva, then remove the pseudomembrane. Right? And no associated or no any clinical procedures are not preferred in the first visit. Just give antibiotics and mouthwash. As I told you, antibiotics are metronidazole and amoxicillin, mouthwash are hydrogen peroxide and chlorhexidine. Right? How to use this? Chlorhexidine and hydrogen peroxide. Hydrogen peroxide which is equally mixed with your warm water, and the patient have to be gargled every 2 hours. Right. And second visit when the patient comes, you can go for scaling. And ask the patient to continue the hydrogen peroxide mouthwash and chlorhexidine mouthwash. Okay, no root planing is recommended in the second visit. The third visit, you can go for root planing. Alright, and here ask the patient to continue 3% hydrogen peroxide. Stop the patient to go for 3% hydrogen peroxide and continue the chlorhexidine for next 2 to 3 weeks. Right. The time period between the first visit and second visit is 1 to 2 days, and the second visit to third visit is 5 days. So this is what given in the Karatza. Right. What is the drug of choice for vancomycin resistant Staphylococcus aureus? Right. So the answers given, the options given are linezolid, teicoplanin, meloxicam and prednisone. So you can eliminate these two options easily, right? So both are not an antibiotics. Meloxicam is an NSAID, prednisone is an corticosteroids. So only 2 antibiotics are remaining, linezolid and teicoplanin. So which is the answer? We will say one by one. So initially for Staphylococcus aureus, they started to give penicillin. Penicillin is an effective drug for Staphylococcus aureus. But after some time, resistance mechanism occurred for the penicillin, right? So the Staphylococcus aureus, which produce an enzyme called as penicillinase. So what is this penicillinase did? The penicillinase act like a scissor. Okay, so this is the molecule which cut down the penicillin. So penicillin is not effective against Staphylococcus aureus. So our scientists, they did some research and they find out a new way and given a new type of antibiotic called as penicillinase resistant antibiotic. Penicillinase resistant beta-lactam antibiotic. Those penicillinase resistant are very importantly methicillin. So penicillinase resistant organism you can go for methicillin. So after some time when you give a methicillin, again the Staphylococcus aureus got even resistant to methicillin. So what is the resistant mechanism for methicillin? So this methicillin will go and bind to this microorganisms. Just imagine the microorganisms are look like this. This one example. Okay. So it like this, right? So if there is, so this is something like penicillin binding protein, where this methicillin go and bind. Right? So these organisms are very clever. It just changes the shape. Now methicillin confused and it cannot able to go and bind to the particular protein where it regularly binds. Now methicillin also doesn't work. So those organisms are called as MRSA. That is methicillin resistant Staphylococcus aureus. Now our scientists which give a new antibiotic for this also. So what is this? Drug of choice for MRSA is? Yes, good. Vancomycin or teicoplanin. Many MCQ books which given or many repeated MCQs which are given from this topic. What is the important side effect or adverse effect of vancomycin? So when you give vancomycin in a huge amount, it releases histamine. So those histamine which causes vasodilatation, which causes a red color, so which is called red man syndrome. So the important adverse effect of vancomycin is red man syndrome. So these organisms again very clever, which got even resistance to vancomycin. So those organisms are called as VRSA, vancomycin resistant Staphylococcus aureus. So what is the drug of choice for vancomycin resistant Staphylococcus aureus? That is the question which was asked to you. The answer for this is linezolid. Clear? So what is the take home message? So don't just read the facts. So just know the background of each questions so that you can able to answer according to the recent NEET pattern. So that is what the examiners want. So according to me, so even for the next 2 years or 3 years, the same NEET pattern you can expect. So this is just a starting point of your next exam. So probably for those students who are writing the exam on the next year, you can expect the same trend. So give more importance for concepts and the associated points within MCQs. Right. So I just repeat one more time or recall one more time. So for Staphylococcus aureus, initially they given penicillin. Penicillin got resistant because the Staphylococcus aureus produce a scissor-like molecule that is called penicillinase, which cut down the penicillin. For those organisms we given methicillin. Methicillin got resistant because of the altered penicillin binding protein, and the drug of choice for this MRSA, which is called as vancomycin. Vancomycin also got resistant. So drug of choice for VRSA, that is vancomycin resistant Staphylococcus aureus, is linezolid. All these things which you have to know very clearly. Right. Now coming to the probable multiple choice question, you may get it in the next exam. Drug of choice for penicillin resistant Staphylococcus aureus. Can you able to tell? Yes, now tell me. Methicillin. Drug of choice for methicillin resistant Staphylococcus aureus. Vancomycin, teicoplanin. And drug of choice for vancomycin resistant Staphylococcus aureus, linezolid. Even they may ask you what is the resistant mechanism of penicillin, methicillin, all these things in your exam. What type of bone density seen in anterior maxilla? D1, D2, D3, D4. So for this you have to know this MISH classification. So these are the 4 type of bone density, D1, D2, D3 and D4. There is one more type which is called D5. D5 is uncalcified bone matrix, which is not suitable for the implant placement. So D1 which has the highest bone density, okay, and D4 which has the least bone density around 150 to 350. If it is less than 150, that is D5. So this D1 which is present in the anterior mandible, D2 which is present in the anterior posterior mandible, anterior maxilla, all this. So if you read this, it may confuse you. So for easy understanding, I just give you a schematic diagram to you. So this is maxilla and mandible. In maxilla, anterior region and posterior region. Anterior region, more common type of bone is D2 and D3. Posterior maxilla, D3 and D4. In anterior mandible, D1 and D2, D2 and D3. So otherwise you can remember like this, starting from the mandible, D1, D2, D2, D3. So the same thing which will come here in anterior maxilla, D2, D3. And coming to the posterior maxilla, D3, D4. Very easy, right? So now the question which was asked in exam, what type of bone density is seen in anterior maxilla, right? So anterior maxilla you can have both D2 and D3. So answer for this is either you can go for a D2 and D3, but preferably D2 is the answer. So this is one of the questions which was asked. Does the intensity increases change in perception of color? So what is this effect called as? So many students eliminated this second and fourth option. So they have confusion between metamerism and basal-Brockie effect. So I just give you some example for this metamerism and basal-Brockie effect, so that you should not make confusion in your next exam. Right. So what is called metamerism? So for an example, so you did a composite restriction for a patient, okay, and you done your proper state selection. So you did a composite restriction, you became very happy, and the patient also very happy. So the patient went to his home. So but the next day the patient again come back to you, and maybe he say, so the particular composite restriction what you given does not match with the adjacent tooth color. So this is what called as metamerism. You done a shade selection in a different light. Maybe the family members see the particular composite restriction in different light. So they may say that you doesn't have the matching between this restoration in the tooth. So this is what called as metamerism. So this most often which occurs in some saree shop. So the females or the girls which select the saree in a particular light. So when they bring the saree to the home, they just feel this is a different color what they selected. So this is called metamerism, change in color of the particular object in different light source. So maybe they selected in a LED light. When they come to home, they have a different light source. Maybe they have a quartz tungsten halogen bulb, so there won't be no color match. So this is called metamerism. Basal-Brockie effect. So color change or intensity increases, or when the intensity of the light is increasing, the hue will change. Hue means particular color. Okay, so here in basal-Brockie effect they are talking about the intensity, not about the source of the light. So when they ask you about intensity of the light, just go for basal-Brockie effect. When they ask you about two different light sources, you can go for the metamerism. Clear? Right. So what is called fluorescence? So fluorescence is, even our tooth structure have fluorescent agent. So even a porcelain restoration have a fluorescent agent. So what is the purpose of the fluorescent agent? Fluorescence means the particular object which have fluorescent agent absorb light at low wavelength and emits the light at high wavelength, which is called as fluorescence. So this fluorescence which give a lifelike appearance to the teeth. Right. So this is what called as metamerism. So there are two different light sources. So this is look like here some blue and orange color, and this is a golden and white color appearance, right? So the best example for metamerism which is given to you. Right. The next question, so which is something maybe it look like out of dentistry. So there are so many questions which are asked in exam like this. There is a one question which is asked from appendicitis, and they just given a diagram of liver and lungs. They ask a specific part. Okay, so suppose this question is asked, if you don't know, don't answer this type of question. Definitely it goes to negative marks. So why the examiner is taking these type of questions which is not related to the dentistry? That is the reason, right? So the examiners they just wanted to, so which type of cases you take for the treatment, or which type of cases you have to be referred. So the same mind they expect in the exam also. So which type of question you have to be answered, which question you have to be omit. So like this, the examiner which is expecting you something. Okay, so what is your analysis? So is that you are attending this type of question, or you have to be just omit this type of question? So this is what the examiner wants. So even if you are legend, okay, on the top of the subject, okay, if you doesn't know something particularly, please omit the answer. Probably chances are there it may go to the negative higher. Right. So coming to this question, organ of Corti which is present in the inner ear. So which layer it is present? Scala tympani or scala vestibuli or scala media. So just before we blindly go for the organ of Corti, have a just idea about how the inner ear look like. So when the sound waves goes inside, okay, through the external auditory canal, and it hits the tympanic membrane. It hits the tympanic membrane and it just go and oscillates the malleus, incus and stapes, and it reaches the cochlea. Cochlea is present in the inner ear, right? So starting from the external auditory canal, middle, and it goes to the inner ear. So where the inner ear cochlea is present. So now I just take the cross section of the cochlea. Just cut it and see the cochlea. This is how it look like. So this cochlea has 3 layers. So number 1, this is scala tympani, which is present here. Scala vestibuli, which is present here. So in between the scala tympani and scala vestibuli, you have a basilar membrane, right? You have a basilar membrane. So over the basilar membrane, you have something called as scala media, where this organ of Corti is present. Clear? So what is the function of organ of Corti? Hearing. How it helps for the hearing? So answer for this is scala media, right? Again, come for this diagram. Okay. So this is, especially I just zoom the organ of Corti. So this is about the basilar membrane. So over this basilar membrane, you have an organ of Corti. So this area, I just zoom it and give it to you. So this, over this organ of Corti, you have some hair cells like this. So these are called as outer hair cells and inner hair cells, right? So when the sound wave come and hit this organ of Corti, these hair cells move. So these hair cells, which is called as cilia. So because the movement of the cilia, there is some creation of some impulse. So this impulse which is carried by the nerve fibers to the brain. Now you can feel the particular sound what I am talking to you, right? So clear? So I just recall one more time. When the sound waves goes from the external ear, passes through the middle ear and reaches the inner ear where the cochlea present. Cochlea is an inner ear. I just cut this cochlea in a cross section. I have a 3 layers: scala tympani, scala vestibuli. In between I have a basilar membrane. Over this scala media is present. This scala media have something called as hair cells, outer hair cells and inner hair cells. When the sound wave comes and hit this cochlea, so there is a membrane called as membrana tectoria. So the movement of membrana tectoria, so which act like a windshield. Okay, so when the membrana tectoria moves, it just activates the hair cells also. These hair cells called as cilia. Because of the movement of the cilia, it gives impulse through the nerve fibers. When it reaches the brain, we are able to hear the particular sound sensation. So the function of organ of Corti is hearing, and where it is located, scala media. So this type of MCQs you may get it from in your next exam. Right. So coming to the next one, all these are ideal properties of EDTA. except. So EDTA is a type of a chelating agent, right? So it is a chelating agent. What is the meaning of chelating? Chelating is something it joins with a metal. So it may joins with a calcium ion or something. So here in EDTA it joins with a calcium. So when you irrigate the EDTA into the canal, so this EDTA binds with the calcium, especially in calcified canal, and dissolves the calcium so that it creates some space for the instrument to enter. Right, so EDTA is the best irrigating solution for calcified canal because it has a chelation property and even it has a lubricant property. So any irrigation material, it should have less toxic. So only it becomes biocompatible. So relatively less toxic. Yes, this is also right. Which one is wrong? The last option is wrong. Right? Pulp dissolving. So which irrigation solution has this pulp dissolving property or removes the organic debris? That is your sodium hypochlorite. Sodium hypochlorite removes the organic part, EDTA which removes the inorganic part. So answer for this is, you can go for except means pulp dissolving property. Right. So what are the other things which you have to be? Some of the important points. Okay. The percentage of EDTA, either 17% or 15%, and this EDTA which is given by Nygaard as well. Okay, I just tell you one of the important point where they may ask you in next exam something concept related for EDTA. Suppose a patient comes to your clinic, dental clinic or dental college, to your department. So, and when you just started the root canal treatment, you may feel there is a calcified canal in one of the mesial part of your mandibular molar. So most probably mesiobuccal canal. Mesiobuccal canal of the mandibular molar is calcified. So what your professor is advised is just to place the calcium hydroxide and try it, or ask the patient to come after 1 or 2 days. So you just place the calcium hydroxide, you ask the patient to go, and after 1 or 2 days the patient comes. So now the question is asked, right? So what is the first instrument you have to be insert inside the root canal? Probably this question you can expect. So the first instrument you have to be insert is 0.10 tip diameter instrument. So which instrument have this 0.10? You have several files, right? 10, 15, 20, 25, 30. So what is the tip diameter of 10 size file? 10 size file, 10 by 100. So this is the tip diameter 0.10. So we have to be insert only 10 size file inside the root canal when you place an EDTA. Why not 15, 20, 25 all this? There is a reason. So this EDTA only removes this amount of the calcium. So only 10 size file can able to enter inside the root canal. If we place 15 size file, it does not goes. So once you insert your 10 size file and enlarge the root canal, it creates some space, then you can enter the 15 size followed by 20, 25, all these things. So this is a small concept what you have to be understand related to the EDTA. Right, the next question, which of the following material has least shelf life? The answer for this is condensation silicone. Right, so the reason behind this is condensation silicone which releases byproduct like an ethyl alcohol, so it just stay for a smaller period of time. Right, this is one more question which is something controversial options which is given by the students. So which of the following is not present in the root of the teeth? Some students, all these are same. So only the last option. Some students say pulp and some students say pulp chamber. Right? So just we see this. So which is not present in the root? So if we go for these options, so pulp is present in the root, direct question. Symptom is present, dentin is present, but which is not present? Enamel is present in where? Crown surface. Just straightforward question. But when you come here, it is a tricky question. If the pulp chamber is given, it is a tricky question because pulp chamber is present in the crown part. Okay. But enamel is present in the root surface in some cases like ectopic. ectopic enamel present in the bifurcation area. So enamel is present in the root bite, pulp chamber is present in the crown, so you can go for the pulp chamber if these options are given. If these options are given, you can go for enamel. Clear? Right. Again, this is one more controversial type of question. Heat sensitive instruments are sterilized by hot air oven. You cannot use for heat sensitive instrument, right? It melt. Autoclave, it melt. So you can eliminate these two options easily, right? Now we come for two options. Either I can go for a plasma sterilization or ethylene oxide. Yes, what Panikar says. Okay, we cannot decide, right? So according to the Panikar, I just taken from this textbook directly. So what Panikar says, they must be sterilized. All the critical items must be sterilized by autoclave if it is heat stable. If the instrument is heat stable, you can go for autoclave. Or with ethylene oxide or hydrogen peroxide gas if it is heat sensitive. Ethylene oxide or hydrogen peroxide gas plasma if it is heat sensitive. So ethylene oxide is given here. So we can go for ethylene oxide, right? But no, you cannot tell it directly as ethylene oxide. So the next page of Panikar, what they given is new methods of sterilization of heat sensitive articles. They are just telling plasma sterilization, right? So now I can go for what? Plasma sterilization or ethylene oxide. So always better you can go for a what is the recent. That is what examiner want. So plasma sterilization is the ideal one for this particular question according to myself. So this is plasma sterilization, right? So this is a very straightforward question, right? Most common salivary gland tumor is pleomorphic adenoma. In case if they ask you most common malignant salivary gland tumor, you can go for mucoepidermoid carcinoma. And what is the very special histological feature of canalicular adenoma? So this is party wall appearance. Nowadays histological diagram is very common in your NEET exam. So they may give you some party wall appearance of histological picture. They may ask you which salivary gland tumor this is. So this is for canalicular adenoma. And which is the most common type of mycobacterium associated with the HIV patient, right? So in case of HIV patient, and just before that we can go for what is called AIDS. In the CD4 cell count less than what we can say it is AIDS. It is CD4 count less than 200. Again one of the multiple choice question. And which mycobacterium is common in HIV patient? This is the question. So both Mycobacterium tuberculosis and Mycobacterium Avm Intracellularity both are common in HIV patient. But when you compare these two things, Mycobacterium tuberculosis and Mycobacterium Avm Intracellularity, so Mycobacterium Avm Intracellularity, which has associated with 55% of the HIV patient. Mycobacterium tuberculosis, which is associated with 35% of the HIV patient according to the many studies. So obviously the Mycobacterium Avm Intracellularity is the most common mycobacterium associated with the HIV patient when compared to the Mycobacterium tuberculosis. Right, what is this Mycobacterium Avm Intracellularity? So Avm is a separate organism and Intracellularity is a separate organism. Both are different species associated with Mycobacterium, but still, so distinguishing between this Avm and Intracellularity is very difficult. So we are telling Mycobacterium Avm Intracellularity together always. Right. The next question. Among the following, which is the noradrenergic selective, this is noradrenergic selective serotonergic antidepressant. Right. So the answer for this is mirtazapine. So again this is a one of newer question which is asked to you. Generally for a dental students, antidepressant they won't give much importance. So but still in this exam they asked about this type of question, right? So just before we see what is the special about mirtazapine, you have to know what is the mechanism behind the depression and antidepressants, right? To see about depression, what leads to the depression. Okay, generally decreased monoaminergic chemicals which leads to the depression. So example for the monoaminergic chemicals are number 1 noradrenaline and number 2 serotonin, right? So decreased serotonin or decreased noradrenaline level which leads to the depression. So suppose in case if you feel depression, just go and buy some dark chocolate in the shop or supermarket. So if the dark chocolate or popcorn which has more of serotonin, okay. So one of my friend actually he became very depressed just before exam. So he went to just meet psychiatrist. So for the depression, so the next day's exam, but he went for severe depression. So because of the fear and which associated things, and the psychiatrist advised a simple advice given by the psychiatrist is just close all your books, okay, just buy some popcorn, okay, just eat the popcorn very slowly and just watch TV, okay, for a few hours. Okay, so he just taken the popcorn and he became alright. So because the reason behind this is popcorn contain more amount of serotonin. That serotonin has the problem of decreasing the depression. This is just for a small period of time. In case the patient is having a chronic problem of depression, okay, due to some psychiatric problem, that time we have to go for only this antidepressants. So those antidepressants which I can classify into two types. Number 1, typical antidepressant, right, and number 2, atypical antidepressant. So what is the difference between typical and atypical antidepressant? So typical antidepressants, number 1, either it decreases the metabolism of this monoaminergic chemicals. Either it decreases the metabolism, means it decreases the breakdown of these chemicals. So which increases the chemical, right? Number 1. Number 2, which decreases the reuptake into the neuron, which is decreased by this typical antidepressants. But coming to the atypical antidepressant, which act by different mechanism, okay. And example for this atypical antidepressant is this mirtazapine. So what does this mirtazapine do? What is the mechanism of action? So mirtazapine, otherwise called as, we studied noradrenergic selective serotogenic antidepressants, right? So what mirtazapine do is, it decreases presynaptic release of noradrenaline or presynaptic action of noradrenaline. So because of this presynaptic action of noradrenaline level in the blood is increased. Generally the presynaptic which decreases the control of neurotransmitter. So because we just blocks this presynaptic, noradrenaline level in the blood is increased and it also increases 5-HT, that is 5-hydroxytryptamine. It is nothing but serotonin. There are several types of serotonin like 5-HT1, 5-HT2, 5-HT3. But this mirtazapine which selectively act on 5-HT1. So that's why it is called as selective serotogenic, okay, noradrenergic. So that is called. So all together we can say it as a NASA, noradrenergic selective serotogenic antidepressant, which is a atypical antidepressants. So with that you have to go for your classification of the antidepressant. You have to know which are all come under typical, which are all come under atypical antidepressant. Right. The next, which is the most common antigen present in a AVO blood group or any blood group, either it is a AV or AVO. So any blood group which is the common one. So in case of A blood group, A antigen is common, but it is not present in a B blood group, right? So we can eliminate this two, right? So many students have confusion between these two, either D antigen or H antigen. Very simple. D antigen denotes or describes the particular blood group is positive or negative. Okay, so in case A positive patient or A group positive patient will have D antigen is present. D antigen is absent in A negative. But H antigen is present in all the blood groups except one, that is Bombay blood group. There is a special type of blood group which is called Bombay blood group. So this H antigen is absent only in this. Okay, so those things are those questions which are discussed in this particular video. If you found useful, kindly like, share, subscribe, and also tell your friends. So happy to help you. Thank you.